with the continuation of the topic thoracic outlet syndrome. In my first video, we have discussed about the anatomy, what are the structures involved in that syndrome, how it happens, what are the causes, the etiology, a little bit about the treatment part, and I told you that in the next video, part 2, I will be describing a few tests, provocative tests, how to confirm or come to a diagnosis of this condition. So, as we have discussed earlier, thoracic outlet syndrome is the compression of the neurovascular bundles, the structures, that is the brachial plexus and the subclavian artery, the subclavian vein, which comes from the thorax, or it continues and exits to the upper extremity. Now, this plexus, it feeds the neurological messages or the neurological communication with the upper limb. It is continuing to the whole upper extremity. The subclavian artery gives the arterial blood supply, and the subclavian vein, the deoxygenated or the impure blood goes back to the through the subclavian vein. So there are some important structures present here, and basically these structures are compressed, or when some of the structures, the muscles or the bones have some anomaly, or the muscles are tight. So what are those? We are going to discuss that. First is the anterior scalene syndrome. As I said, this happens in the scalene triangle, the space formed by the anterior scalene muscles and the medial scalene muscles and the superior border of the first rib. So when the scalene muscles are tight, they are going to compress the structures, and basically the neurogenic type is the commonest here. It compresses the brachial plexus. The second type is the costoclavicular. The costo means the rib, the first rib, then the clavicular, the space between. So here also, if the clavicle is fractured or the clavicle goes down and imposed on the first rib, then also the structure will be compressed. Or sometimes the first rib is brought up, as we see in labored breathing, or when there is a respiratory problem and when the person is using the accessory muscles to breathe, there is a labored breathing we call, then the first rib comes in contact with the clavicle and the structures are compressed. And the third is the pectoralis minor and the rib cage. Here also, if the pectoralis minor muscles are tight, or the patient is having a rounded posture, like we see in the upper cross syndrome, when the posture is round, the muscles are tight, then also we will see this kind of compression. So now, first coming to the anterior scalene syndrome, we have this test called Adson's test, ADSON, Adson's test. So here, what we are going to do is first make the person relax, explain him what we are going to do, I have already explained him before this video. Now I will support the arm and I will just check for the radial pulse. Now here when we are going to see the radial pulse, I am not going to see the rate of the pulse. I am going to check the strength of the pulse, and then I will ask the patient, the model, to look towards me and then extend his neck and look the ceiling. In this position, the scalene muscles are further brought into taut position, because already the scalene muscles will be tight in this case, and when you further take this position and hyperextend the neck, the scalene muscles are going to be taut and the compression will be more. So the result will be that the radial pulse will become weak and the person will complain of the neurologic symptoms like the paresthesia, the numbness or the tingling. So that considers a positive thoracic outlet syndrome test for the scaling. The next test we are going to see is for the costoclavicular syndrome. And same here, we are going to hold the arm, check the radial pulse, and then we will instruct the person or the patient to keep his chest muscle upright straight, like an attention position in front of, when you are standing in front of a commander, or when you are in a parade, you are doing the attention position, bringing your chest tightly front. What will happen? It will push the first rib anteriorly and it will push the clavicle posteriorly. So what will happen? It will compress the structures. If it is already compressing, then these will further exaggerate, and then the same thing will happen. There will be weak pulse and the other radiating symptoms like paresthesia and numbness. The third test is called the second test. What we have discussed now is the Eden's test, EDEN. The third test is the Wright's test, WRIGHT. It has two parts. The first part is finding the radial pulse, feel it, then try to take the upper extremity back posteriorly. Here we are going to look for the pectoral tightness. So already the pectoral muscles are tight, and this will be stretching the muscles, and then the radial pulse we will feel low, or the other symptoms will rise, which give to a positive test. The second part of this test is same, feel the radial pulse, take the hand overhead and try to feel the pulse. When you take the upper extremity overhead, here the structures will be again taut and the radial pulse may become weak and other symptoms may be present, which will give the test a positive indications. So these are the three basic tests what we discussed today for the thoracic outlet syndrome. The first, the Scarini syndrome, we have discussed the AdtU test. The costoclavicular syndrome, we have discussed the Eden's test, and the third, the pectoralis minor syndrome tightness, we are seeing the Wright's test. And the fourth condition, that is the anomalous growth of the cervical rib, that is an abnormal growth from the C7 vertebra. We can confirm in X-ray, in MRI, and that may lead to the positivity of the thoracic outlet syndrome. So okay students, we have discussed these tests, we have discussed the anatomy. Please watch these videos, and I'll be happy to answer your doubts. Please come forward with your doubts in our group, WhatsApp group, or the Google Classroom, and hope you will be helpful from this video. And I want to thank Hiren Kalita, and he has helped me in describing this test. Okay, thank you.